Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
And now, the Federal Drive with Terry Gerton, sponsored by GEHA.
Welcome to the Federal Drive on Federal News Network. It's Wednesday, June 3rd. I'm your host, Terry Gerton, and I'm glad you're here. Coming up on this hour of the Federal Drive, helping disaster survivors recover is one of FEMA's most visible missions. A new GAO review looks at how well that assistance actually lines up with what survivors need on the ground. Plus, telehealth expanded quickly, but oversight is still catching up. Those stories and much more ahead during this hour of the Federal Drive. We begin with this. Enrollees in the government's health insurance program will soon face tighter requirements when adding family members to their plans. A new final rule from the Office of Personnel Management will expand the verification process for insurance enrollees. It's an effort to reduce spending on ineligible participants. Here with more details is Federal News Network's Drew Friedman. Drew, thanks for being here.
Good to be with you as always, Terry.
Ineligible participants, how long has that been an issue for federal health programs?
We've been hearing about this from inspectors, general offices, the Government Accountability Office since at least the early 2000s. Ineligible family members on federal health plans can contribute to rising costs of premiums for enrollees and also increase the administrative costs for the Office of Personnel Management to run these major insurance programs for federal employees and retirees. For example, recently in, I believe, 2019, there was a report from OPM's Inspector General Office that called ineligible members of the Federal Employees Health Benefits Program a known area of substantial fraud. And then concerns about this escalated even further after there was a 2022 report from GAO finding that OPM did not have a clear way to either identify or remove ineligible family members, and that was costing up to $1 billion annually in the costs of running the FEHB program. So this has been going on for a long time and something that OPM has, in small steps, been trying to start addressing for many years now.
What are those previous steps? How have they tried to solve this problem?
Well, back in 2018 is when OPM first had some regulations about this, where they began requiring enrollees when they had a qualifying life event, or QLE in other terms. So this is, for instance, if someone gets married or has a child, the birth of a child, then in those cases, they would need to add that new family member onto their insurance plan. So in 2018 is when OPM began requiring during a qualifying life event for those enrollees to prove or verify that that person was truly who they say they were as their family member. But during open season, there's not that same requirement, or at least there wasn't for many years now. And then also later in 2024, after we saw that GAO report that talked about the spending on ineligible members, OPM began requiring validation of a random 10% sample of participants to try to weed out ineligible members of the program. But that requirement has not fully taken shape yet, according to OPM. They said due to a lot of transactions during the 2024 open season and then the staffing challenges in 2025, a lot of agencies didn't reach that 10% requirement. So that's something where it's a step that OPM said they'd be taking, but we haven't seen that take full effect yet.
So what are the current verification requirements then, and how will they change under this new final rule?
So as I mentioned, back in 2018 is when OPM began requiring the verifications for qualifying life events. This final rule is going to expand the verification process to also cover open season additions of family members onto insurance enrollees' health plans. So by expanding this, OPM is, one, fulfilling the obligations of a 2025 bill that was passed that asked them to create this process. And then also they said it's going to essentially reduce the presence of ineligible participants being newly added to the program.
And just to be clear, Drew, who are eligible and who are ineligible family members?
So family members, their eligibility, of course, depends on their relationship to the enrollee themselves, whether that's a current federal employee or a federal retiree. So, for example, an eligible dependent is a child who's under age 26 or a spouse, someone who is married to a federal employee, for example. But then if you have the grandchildren of a federal retiree, their parents, former spouses, if you had a divorce, or domestic partners, maybe you live with someone but you're not legally married to them. Those are all, according to OPM's regulations, those people are not authorized to receive the benefits through the government's health insurance programs. OPM has estimated that combined between the FEHB program and then also the postal insurance program, there are about 4 million family members who are total enrolled in the programs, and about 3% of those 4 million are estimated to be ineligible for the benefits.
So what does this all mean for FEHB enrollees in practical terms? What do they have to do next?
So this applies to enrollees in cases where they're looking to, again, add a new family member to their plan, whether that's during open season or any other time of the year when they experience a qualifying life event like getting married. They will have to provide documentation like either a marriage certificate, a tax return, a birth certificate, whatever is applicable. And OPM has a list of the documentation that would be required during those cases. And they would simply have to provide that information to OPM to confirm that their family members are eligible for the benefits and that they are indeed who they say they are. And the new process in OPM's estimate would require about 100,000 family members each year to be verified in this way, just based on trends we've seen over the past several years of how many family members do get added each year. OPM says that going forward, in addition to this verification process, they're also preparing to do an audit of all the currently enrolled family members. So looking into ineligible members there on top of ones that are looking to be added to enrollees' plans here.
And this new rule is effective immediately, or is there some break-in period?
It's going to be about 30 days before the final rule takes effect, and that aligns with the legislation that we saw last year called the FEHB Protection Act, which required OPM to set this up by July 4th of 2026. So they're right on schedule here.
That's Federal News Network's Drew Friedman. Drew, thanks for sharing this update with us.
Absolutely. Thanks, Terry.
You can find her story at federalnewsnetwork.com. Up next, helping disaster survivors recover is one of FEMA's most visible missions. A new GAO review looks at how well that assistance actually lines up with what survivors need on the ground. This is the Federal Drive with Terry Gerton on Federal News Network.
Tune in Tuesdays at 10:30 a.m. and 2:30 p.m. for the Innovation in Government Show, sponsored by Carasoft. Hear from the industry leaders advancing the technologies shaping how agencies modernize, secure operations, and deliver better services. Innovation in Government covers what is changing now, what is working from cybersecurity and cloud to data, AI, and emerging technologies. Listen to Innovation in Government, Tuesdays at 10:30 a.m. and 2:30 p.m. on Federal News Network. Search Innovation in Government.
Welcome back to the Federal Drive with Terry Gerton on Federal News Network. Delivering disaster assistance at scale is one of FEMA's toughest operational challenges. A GAO review looks at where the system struggles to match survivor needs after major disasters. And Chris Curry, director in the Homeland Security and Justice team at GAO, is here to walk us through the details. Chris, welcome back to the show. Thanks for joining me.
Thanks for having me again.
Well, we're coming into hurricane season and fire season, so this certainly is timely. Based on your review, how well does FEMA's disaster assistance system match the actual needs of survivors after a major disaster event?
Yeah, so what we've been trying to do is issue quick, short reports to detail, where FEMA is in its reform efforts, particularly over the last year when there's been a lot of changes in the agency. First report we did last fall was looking at FEMA's workforce and the workforce reductions. The second one that we did, which came out earlier this year, was looking at state and local preparedness and how ready they are to absorb more disaster response and recovery responsibilities. And then this most recent report is looking at FEMA assistance to individuals, because most assistance that goes directly to individual citizens actually comes from the federal government and FEMA after a disaster. So if state and locals are going to be doing more, we thought it was important to look at what they're going to have to do in the future for everyday people.
Well, we're coming into hurricane season and fire season, so this certainly is timely. Based on your review, how well does FEMA's disaster assistance system match the actual needs of survivors after a major disaster event?
Well, can I just say, first of all, we got really lucky last year in the country because we did not have a large landfalling hurricane or multiple concurrent large landfalling hurricanes, which happens quite a lot. I think that might have lulled us to sleep a little bit, to think that there hasn't been many changes in FEMA's operating posture. Things are looking pretty good. That could not be further from the truth, because, if we get another situation like we had in 2024 with Helene, Hurricane Helene, then we're going to be in a much different situation. But the bottom line is that the major challenge with FEMA's assistance to individuals is that it's a system that requires the individual citizen to work really hard to extract the resources and the help from FEMA. It's not a customer-centric system. It's not designed to help the individual survivor coordinate and get the most assistance they can as quickly as it can. And it's not that that was done on purpose. These programs were developed over time to help people, and FEMA's goal is to help people, and there's dedicated people there trying to do that every day. The problem is, over time, you have multiple programs, a lot of regulations, a lot of red tape, a lot of bureaucracy, a lot of process put in place to safeguard dollars and to ensure the integrity of the program. But what that's built up to cumulatively is that it's very frustrating and very difficult for people to get help.
Well, and you're meeting people at a point where they are desperate and may not have all of their file folders and all of their records at hand to answer some questions. What were some of the biggest obstacles that you found that these survivors face?
I want people to put themselves in the shoes of a survivor. So if you've ever dealt with an insurance claim or a difficult customer service problem, just multiply that by like 50, right? If your house is destroyed and you have no belongings, you have no internet, you have no power, and you're still trying to work and send your kids to school and things like that. So let me just give you some examples of what we saw. Let's start with just getting the help. Let's start with call centers. When people call FEMA to get help, or maybe they register online and they're calling FEMA to get questions answered, or they're not clear about something in their registration. We found that a lot of those calls during busy times aren't answered, or if they are answered, they're answered after multiple hours of waiting. And that's if a person doesn't give up and just hang up. So what that does is, first of all, it means that a person maybe doesn't register, they don't get their question answered, or maybe they just assume they're not going to get the help and they give up. So what we don't know is who doesn't continue the process after that type of frustrating situation. That's really difficult to quantify. So another example is how FEMA communicates what they're going to provide to a survivor. So they do this through pretty formal letters to a survivor, which are emailed, they're sent hard copy. And it basically says, you have applied for disaster assistance. This is what we can do for you, or this is what we can't do for you. But in a lot of cases, a survivor, the letter might say, you are denied assistance, or we cannot provide you assistance. And it's not that they're not eligible, it's just that something has to happen first. For example, they need to go through their insurance company first. They need to provide proof that they've gone through their insurance company first. But a lot of people see these letters from the federal government and they say, oh, I'm denied, or I'm not I'm not eligible for assistance. And so they don't continue the process. I mean, these are intimidating processes, and, people don't necessarily continue to try to get the help they need. And it's very frustrating to people. That's what leads to this sense that FEMA says it's there, but when it comes down to it, they don't really provide much help.
Chris Curry is a director in the Homeland Security and Justice team at GAO. Chris, FEMA was affected by a number of funding lapses in the last 12 months. What kind of impact is that having on what's already a really complex system?
It's terrible. I mean, it's just more and more fuel on top of a fire. So over the last year and a half, FEMA's been under a hiring freeze. They've been downsized by about between 3,000 to 4,000 people. They've lost a tremendous number of experienced leaders through deferred resignations and deferred retirements, and all these programs to try to reduce the organization. So morale of the staff, I think it was already low. Then when you add on that two shutdowns over the last year, the most recent one, the longest shutdown in history, a lot of those people were still having to work during that time and not being paid. So, what we hear from the staff and what we hear from state and locals that work with them is that, it's just very difficult to focus on the mission when you don't know if you're going to have a job or you're fearful to make a decision. It's just a very difficult and toxic situation.
Well, let's put the three reports together. You looked at state and local capacity, you looked at FEMA's workforce, and now you're looking sort of at the processes around disaster response. What's the bottom line here? What should survivors expect, and what can we do to try to fix the system?
The bottom line is that FEMA provides a ton of assistance to state and local communities and to survivors after disasters. And while there's frustration with process, nobody disagrees that help is critical and recovery would not be possible without FEMA's help. I think what is being discussed now nationally is how to provide that assistance and who should provide it. Would the state and local government be better suited, being closer to the community or the survivor, to provide that help? Nobody thinks that the federal government shouldn't provide the dollars, though, because state and local governments, they're not fiscally prepared to handle that. FEMA's spent almost $400 billion over the last 8 to 9 years on disaster assistance. State and local governments cannot fund that. The other thing that's the key takeaway is if the process for responding to disaster is going to change and state and locals are going to do more, then that has to be done over time and has to be done gradually. State and local governments have to build up their capacity and their resources to do this and allow time to adjust to any changes. This can't just be done overnight, because that's going to create a very bad situation when we get a big catastrophic disaster.
The FEMA Review Council has finally put out its final set of recommendations for FEMA. Some of the worst hypotheses maybe didn't come to fruition, but there's still plenty in there for change. Many of those changes would require congressional action. There's also pending legislation on the Hill about creating a separate cabinet agency out of FEMA. What does Congress need to do to address some of the issues that you've just laid out?
Well, first of all, you're absolutely right. The council's report, I thought, was very thorough and actually suggested changes that align with many of the things we've recommended over the years. So, for example, what I just said earlier, making disaster assistance more accessible to survivors and less frustrating, reducing the fragmentation and the administrative bureaucracy behind recovery programs that take often decades to implement and billions of dollars are spent. So those are things that we have advocated for over the years and we've recommended, and I think they're a good idea. I was happy to see the final report walk back some of the more drastic rhetoric about cutting FEMA in half. See, the problem, Terry, is that those statements were thrown out there without any assessment done of what the workforce need was. It was just, let's cut by 50%. Well, why? And what's the mission of FEMA? And how do you know how many people you need? That work has not been done. So, you can't make those decisions willy-nilly until you've actually done the work and seen how many people they actually need. So the other thing that's important, and you said it, is this is a council report. This is not a law. This is not an executive order. This is not a regulatory change. Nothing has changed now going into hurricane season. So in the short term, FEMA still has to do what it has to do to respond to disasters coming up in the future. And it will require regulation, legislation, and executive action. And some of these things, so this is going to take years to implement. I think probably 2 to 5 years to probably implement the reforms we're going to see here. And, until that happens, we need a strong and effective FEMA to be ready to respond to disasters, because we can't just make these changes overnight.
Chris Curry is Director in the Homeland Security and Justice Team at GAO. Chris, thanks so much for sharing this report. Thanks for the great work you're doing on this really important topic.
Thank you.
We'll post this interview and a link to the report at federalnewsnetwork.com/Federal Drive. Listen to the Federal Drive on your schedule. Subscribe wherever you get your podcasts. Still to come, 2 changes moving through the House would reshape how agencies buy, from who gets a shot to how fast decisions get made. But first, telehealth. It expanded quickly, but oversight is still catching up. You're listening to the Federal Drive with Terry Gerton on Federal News Network. Welcome back to the Federal Drive with Terry Gerton on Federal News Network. An HHS Inspector General audit found that targeted system edits and clearer coding guidance could have prevented a share of improper Medicare payments tied to virtual visits. Here to talk us through what those fixes would change and how CMS is responding is Assistant Regional Inspector General for Audit Services at the Department of Health and Human Services, Office of the Inspector General, Carrie Lowry. Ms. Lowry, thank you so much for joining me today.
Good morning, Terry. Thank you for having me.
You know, when COVID broke, we started to get a lot more virtual health care. And CMS has really been expanding access to that virtual care. You recently did an audit of how that all is working. Was there something particular that prompted you to dig into this?
Oh, that's interesting, Terry. These communication technology-based services that are in our report were established right before the start of the pandemic, actually, with virtual check-in services being established in 2019 and e-visits in calendar year 2020. These services are beneficial because virtual care gives the ability to provide services to Medicare patients when access is limited to in-person care. Maybe the patient lives in a rural area, or it takes a great toll to get to a physician's office for that patient. So communication through technology allows for access to these types of physician services. We set out to test whether providers that received payments for virtual check-ins and e-visit services complied with Medicare requirements. As new services are introduced, vulnerabilities with improper payments kind of come along with the territory. So our goal is just to reduce the risk of improper payments made on behalf of Medicare.
So you mentioned the improper payments, and certainly there's a lot more attention right now on perhaps fraud, perhaps improper payments in the medical benefits system. How is this virtual check-in and e-visit process supposed to work under Medicare, and where are the opportunities for fraud and improper payments?
Well, both services are available to patients who have an established relationship with a provider. Virtual check-ins are billed when a provider captures a video or image. A provider doesn't capture the image, but they receive a video or image from a patient. And when the provider responds, they talk to a patient over the phone about that image or what they saw in that video. So that's kind of how the interaction takes place. They want to determine whether an in-person visit is required in what they saw in the video or image. If it doesn't require an appointment, then the virtual check-in service could be billed on its own. If the appointment would be necessary to go over the image, then the provider should bill for an evaluation and management or an E&M service. And then that billing for the telephone call would just be bundled into that E&M payment. So that's the virtual check-in. For e-visit services, patients may initiate contact with a provider for an issue through an online patient portal. And this communication can go back and forth over 7 days. The cumulative time spent making a clinical decision with the patient gets billed as one service provided. So, for example, if a patient initiated the contact and the provider responded through the portal multiple times, through back and forth conversation, that time gets bundled together and the service gets billed once for the cumulative amount of time spent over that 7 days.
So you found cases where the virtual check-ins were billed within days of an in-person or related visit, and e-visits that were billed too closely together for the same condition. Walk us through, kind of a real-life example about how that would happen.
Yes, we observed instances where virtual check-ins were provided and billed within unallowable timeframes to an E&M service being billed. And then we found that the e-visits were provided and billed within a time frame of 7 days of other e-visits when the services should have been billed using the cumulative time spent over the 7 days. So if a patient had an evaluation and management service already have taken place, and then they receive a phone call 2 days later from that patient about the same issue or an image about the same issue, then that phone call should not be billed separately as a virtual check-in. It should be kind of a follow-up contact to the E&M visit and should just have been bundled into the payment for the E&M service. So both of these issues are not in compliance with Medicare rules and could result in potential overpayments.
Carrie Lowry is Assistant Regional Inspector General for Audit Services for the Department of Health and Human Services, Office of the Inspector General. So, Carrie, I can imagine a doctor's office that's got 1,000 things going on and people on the phone and on an email conversation, whatever. Do these kinds of behaviors, are they just human error, or are they actually evidence of systemic fraud in the system?
Well, I think it could be a little bit of both. In our case, it seemed to be a little bit of provider confusion and oversight gaps with, implementation of new services being available to patients. The Centers for Medicare and Medicaid Services provides guidance to providers on how to bill these types of services. But the guidance is sometimes limited to the types of providers that can bill for these services, the communication types that can be used, or the established patient relationships and other similar directives. CMS's guidance within the physician fee schedule is limited to brief descriptions of CPT codes, which are current procedural technology codes, and healthcare common procedure coding codes, which HCPC for short, and the time interval requirements, which may lead to inconsistent or inaccurate billing by providers.
The dollars associated with your findings here are relatively modest, about $2.3 million, but they do involve a large number of claims. So what does that tell you? Were these focused in particular geographic areas or with practices, or were they really widespread across the whole country?
Yeah, the $2.3 million does seem a little modest. A large volume of the claims indicate that these billing issues could be widespread across lots of different types of providers overall. The pattern really demonstrates that the vulnerabilities weren't just isolated to a few outliers. We saw the potential issues occurring across both the virtual check-ins and the e-visits because CMS didn't have the key system edits in place to flag certain types of non-compliant claims. And without those types of safeguards, even the small amounts over repeated billing errors, they accumulate across a broad provider population. And that's exactly what we observed in this review.
So is there a simple systems fix for this? Some coding in there that says if this happens, you get a flag? Or is this a training and personnel problem, or a little bit of both of those together?
Well, I think it is a little bit of both. As I talked about the CPT codes and the HCPC codes, if we can get CMS to provide proper guidance to providers on a regular basis, then I think it will limit the amount of billing errors that we see coming from providers, and especially if there's edits in place to flag these types of errors.
How did CMS respond to your recommendations?
Well, we made 3 recommendations to CMS regarding the provider billings for virtual check-ins and e-visits. Overall, the first recommendation involved system edits for billing communication technology-based services as a whole. Specifically, though, for virtual check-ins, we want them to develop an edit to further check for E&M services provided within 7 days before or the 24 hours of the E&M service and that are billed with the same diagnosis code. That way it kind of flags it as, they saw the patient for the same reason. And then for e-visits that occur and are billed separately for the same diagnosis code within 7 days of each other should also be flagged. The second part of this recommendation was to develop an edit that would identify and reject claims where virtual check-in services and E&M services are billed on the exact same claim. And CMS concurred with this whole first recommendation on system edits. Our second recommendation in the report was that CMS strengthen the HCPCS code descriptions for these services in the physician fee schedule. We want them to clarify the meaning of a related or same medical condition or the soonest available appointment. And that would hopefully ensure accurate billing of the virtual check-ins. CMS did not concur with this recommendation. The third recommendation was to further educate providers, which I mentioned before, on the proper billing requirements for virtual check-ins and e-visit services, and they concurred with this recommendation. The implementation, we feel, of these recommendations would hopefully ensure that the virtual check-ins and e-visits are being billed and paid appropriately by Medicare, and it would reduce improper payments.
Are there other aspects inside the CMS Medicare billing process that could benefit from this kind of look or from this kind of solution approach?
Oh, I think any codes that are new and upcoming that CMS puts out there or the physician fee schedule, any new code probably needs an edit to check for the proper use. So,
just a design feature then that we should consider going forward.
Yes.
I've been speaking with Carrie Lowry. She is Assistant Regional Inspector General for Audit Services for the Department of Health and Human Services Office of the Inspector General. Ms. Lowry, thank you so much for walking us through this report.
Oh, of course, Terry. Thank you so much for your time and questions today. It was great chatting with you.
We'll post this interview and a link to the report at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts. Coming up next, 2 changes moving through the House would reshape how agencies buy, from who gets a shot to how fast decisions get made. This is the Federal Drive with Terry Gerton on Federal News Network. Welcome back to the Federal Drive with Terry Gerton on Federal News Network. The House is trying to give the rule of 2 more legal weight, even as it pushes agencies to move faster on acquisition. One effort tightens expectations, the other opens the system up. Former GSA Administrator Emily Murphy is here to walk us through what these changes might mean for the daily work of buying for the government. Emily, thank you so much for joining me today.
It's wonderful being with you, Terry.
When you and I talk contracting, we often talk about rules and regulations in the administrative side. Today, I thought we'd tackle some legislation for something different. There are a couple of pieces of legislation that are working their way through Congress. Let's start with what might be coming out of the House Small Business Committee, trying to put the rule of 2 into statute instead of having it in regulation. So step back for a minute and tell us, why are they trying to do that and why would it matter?
So the rule of 2 is actually sort of a compromise provision. So it says that if something is suitable, or if there are 2 or more small businesses that can compete for something at a fair and reasonable price, you're supposed to set it aside for small business. And that was something that was regulatorily derived from Section 15 of the Small Business Act years ago. And 15 says actually you're supposed to set aside for small business anything where it could help the industrial base or where they decide it's in the best interest of the country. It has a very, very broad aperture of what could be set aside for small business or should be. So that rule of 2 was a regulatory compromise reached many years ago. But then there was some concern when the RFO process was happening last year. And you saw the small business community getting more and more concerned with, are they going to preserve the rule of 2? Is it going to continue to exist? And so I think that this legislation is HR 2804, Protecting Small Business Competitions Act of 2025, came out of that fear. And it's an attempt to go in and just codify that the rule of 2 is the rule of 2, that we will set things aside for small business if there are 2 or more small businesses. Now, the interesting thing is, as introduced by Congresswoman Velasquez, it would apply to task orders and to delivery orders, anything above the simplified acquisition threshold. As it was marked up, it still applies to contracts, but not necessarily to task orders. So that it's interesting to see how that substitute came into being, and then it passed on voice vote out of the House Small Business Committee. So it'll be interesting to see if it actually progresses on. There's a companion bill in the Senate. Does it get attached to the defense authorization bill this year? Does it move as a standalone bill? What happens next with this? Because they seem to find a decent compromise on how to make sure that they preserved how the rule of 2 was operated for many years now.
Would you think that the removal of the task order provision limits the impact of this, or does it just reflect how procurement actually works today?
It actually reflects how procurement works today. And if you read through other parts of Section 15 of the Small Business Act, they already envision that things like multiple award schedules and task orders didn't need to be set aside. It was at the discretion of the administration. And in the past, we've seen different administrations approach it different ways. The Biden administration said, we're going to set aside task orders unless they're on schedules, and then we're not going to set them aside. The current version of the Trump administration came in and said, no, we're not going to do set asides on task orders. You can voluntarily set aside on task orders, but we're not going to mandate setting aside on task orders. And in fact, the decision to allow voluntary set asides against schedules came up in the Bush administration when I was at GSA then. So there's been some flexibility that's been built in over the years. And I think that this gets us back to more, the administration gets to make the call on task orders, but we want to make sure that when you're talking about a full contract, that the rule of two continues to apply.
And if the rule of two is codified in law, does that change anything on a daily basis for contracting officers?
Well, it raises some new protest opportunities, possibly, because the way that it's been interpreted so far, it's been a regulatory provision where there's been some discretion to the contracting officer. This would have a statutory backstop on it. And we saw this happen with the Kingdomware case over at the Department of Veterans Affairs, where they had said, you shall set it aside for service-disabled veterans or veteran-owned small businesses before you look at any other set-aside. So does that change? Does this give it, it's not the same language exactly, but the language that passed for VA gave SDVOSBs and VOSBs precedence over Ability One. Would this change that? And I'm not sure it's written in such a way that it would, but that would remain to be seen.
Emily Murphy is Senior Fellow at the George Mason University Baroni Center for Government Contracting and former GSA Administrator. Well, Emily, let's turn our attention from small business to big business and defense. The chairman's mark of the NDAA had some interesting provisions to try to get DoD to speed up acquisition. What's the core shift you see there?
So there is so much in the NDAA. I mean, the NDAA, Title 8 of the NDAA is always my favorite to go in, or Section 8, the 800 series, because it's where you see that there's some collaboration, there's been some work done, and what is concerning Congress? Where are they responding to what the administration's doing? Where are they trying to, push ahead? What's happening? And this year we see, that we're revisiting some old favorites, like we're looking at acquisition thresholds again, and increasing the micro purchase threshold, increasing the simplified acquisition threshold, but also trying to revisit it so that we do that every 3 years rather than every 5 years. An idea that maybe we're not, that we're letting these lag behind too long. Now it'll be interesting to see, does the Senate agree on that provision? But other things where they're saying, we need to be doing things in a more uniform way. We need a contract writing system as the department. That's been a long-standing push. We're not sure we're thrilled with how the defense contract audit agencies are working. We need a review there because are they actually holding us back? Or do we have too many rules? How are we handling other transactions authorities? When do we want to be using those? So all sorts of fun things in there. Even, we revisit LPTA, the lowest price technically acceptable. When can you use it and when can't you use it? All sorts of really interesting provisions in there this year. There are even some small business contracting provisions because there's the subcontracting plan that DoD uses. It's a slightly different one than everyone else uses that's in there. And then you see some real focus on the workforce also. So there's the creation of chief acquisition talent officers. This idea that we really need to be focusing on the acquisition workforce if we're going to get that speed, if we're going to get the results. We're going to actually have proficiency requirements for the acquisition workforce. And we're going to have this not just at the department level, but at each of the services. And we're going to have this, cascade down. There's an idea that I love that we've been, that I was pushing when I was at GSA years ago, to buy consumption-based purchasing of IT services and products, like cloud and AI. How do you have to buy it on a specific category? Do you have to know upfront that I'm buying X amount per month, and that's that. And every time we approach that ceiling, we have to go buy more, when you're roaming on your cell phone? Or can we actually say we will pay for whatever we use and therefore negotiate a better price? And that in the past, the issue has always been in doing that, it risks triggering the Anti-Deficiency Act. Because if I spent a lot of money in September, maybe did I have enough money in the budget to cover it? And they're saying, well, no, these are ongoing contracts, and we're going to have some predictability, and we can have some not to exceed clauses and things like that in there. But we don't need to be this restrictive on it in a way that we're buying in a very different way than the commercial markets are. So trying to bring that back down. So I've got to give Congressman Rogers and his staff credit. There's a lot of fun stuff in this year's NDAA.
Just going to say your idea of fun might not match with many other people's, but I love it for you.
My family's very glad that someone else will talk to me about acquisition reform, not just them.
One of the things that seems to come through all of this is that Congress is really focusing on giving program leaders more authority and flexibility. Now, I want to ask you, they say that, but in practice, Congress has not really wanted to leave some decision authority to the Department of Defense. Whenever defense has tried to make some controversial decisions around weapons termination or base closures, Congress, wants that flexibility back to them. Do you think they can really go through with this idea of more judgment, more flexibility equals more speed, and therefore go do it?
I think that they are invested in doing it. I think that at the end of the day, and I'm going to quote Tip O'Neill, all politics is local. And so when a decision starts affecting someone's district or their home state, they frequently do want to come in and revisit it. And honestly, we also want members of, if Congress thinks that the administration is making a bad decision, you sort of want them to come in and say, wait a second, I've got a question about this, and revisit it. The question is going to be how often they do that. On something like BRAC, where we got the whole process together, that was a nationwide debate, and we got to a up or down vote on it. But when you get into some other areas, for example, the president earlier this year had a executive order on defense contracting, and it looked at suspending progress payments in some places. And now we're seeing Congress come back in through this legislation and say, wait a second, we're not sure how we feel about that. We don't want to do that. But then other places they're saying, wait, we really want to be, we're on board with this. Let's limit the number of contract clauses. So they, for commercial items, they came in and said, you can't come up, Department of Defense and Department of War may not come up with new clauses for commercial items if they're not in the FAR or DFAR already. So you can use those clauses, but you can only use those clauses. We're not going to go put more special clauses on things, which seems to be in keeping with what the revolutionary FAR overhaul was going towards, but could also be seen as a way of saying, wait, we don't want to start putting we're not going to try to rebuild a separate system of acquisition. The other one that sort of made me laugh is there's provision in there that says, where are our DFAR clauses? They're saying, we've got a backlog. We've been passing legislation for years now. You haven't delivered DFAR clauses to us. And so we want you to go create a task force that is going to bring in experts from all over the government to help you get those clauses, get those cases written. We want our regulations. So we don't want regulations on one side. We want them on the other. We do what we want you to do what we told you to do first, and then we'll go play with some other stuff.
I've been speaking with Emily Murphy. She's Senior Fellow at the George Mason University Baroni Center for Government Contracting and former GSA Administrator. Emily, thanks as always for your great insights here.
Thank you, Terry. It's always wonderful getting a chance to talk to you.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts. After upheavals across the federal workforce and hundreds of thousands of public servants leaving their jobs, grassroots organizations have been rising to meet the moment. One of those groups is called Feds Forward, which has been building tech-enabled tools to help civil servants navigate career change. Federal News Network's Drew Friedman recently caught up with Karen Lee, a co-founder of Feds Forward.
So what we started seeing in January was the beginning of what we saw unfold through last year, which was kind of a federal workforce departure crisis, right? And that's what everyone started talking about. Feds losing their jobs, people in transition. Factually, that is absolutely true. But the framing, I'd like to push back a little bit on it because it's not the crisis framing is very accurate because of this point in time. In fact, what we are seeing now is just an acute version of an evergreen problem where feds leave government every year. About 150,000 of them every year separate from government, not retire. And every single time people leave the federal service, the question is, what am I good for and what do I do? And what's happening right now is just an amplification of a foundational problem, which is a lack of an infrastructure that enables people to not only translate what they've done in a very unique sector and industry and identify what they could do after that also carries the mission, but also on the other side of the ledger, enable employers to legibly see what people from a completely different sector, how they could nestle into their organization, their industry. We have two groups of people who so desperately want to find each other, but they don't have the language, they don't have the understanding contextually, and they don't have a clarity of what they want to be able to find each other. It's a recognition that on each side of the ledger, there needs to be a translation, a curation, and a very informed matching to bring people together.
When you started Feds Forward, what was your understanding of the problem? Was it something where you knew it was this way, or did that become apparent to you over time as you were getting more involved in this?
So we knew when we started Feds Forward that on the Fed side of the house, that there was foundationally a translation problem. I'd gone through it. So many of my friends and colleagues have gone through it. You will not meet a Fed who will be easily able to say, here are all the things that I've done, and here's what I could do outside of government. And so we knew the basic requirement was translation, being able to take what we've done in government and be able to align it to the same kinds of functions, activities outside of government, just called something different. What we have also come to realize systematically is that that translation has to have layered on top of it an understanding of what the receiving organization does and how they do it. We can get feds to a place where they can do all of those things and know what they want to target on the outside. But if employers on the other side of the ledger don't recognize that feds would make any sense, those applicants will never get through the door. And this is where what we've learned is that there needs to be a translation on the employer side of the house as well. What we've learned through this Feds Forward work over this first year is not that we need to create something new in terms of the approach, but instead blend together all the approaches that have existed and never been finally appointed with the talent in mind of those from the federal sector.
In your experience approaching this from that angle, have you found a difference in the success rate of connecting former federal employees with these opportunities? I mean, what's been the outcome of this kind of approach to the problem?
Yeah, and I would define, Drew, success from a couple different lenses. Success one as, did they get a job? Success two of, did the person, the job seeker, feel satisfied this job was the right job for them? Success three, is the employer happy that they got that candidate? And the answer is yes, and I'll tell you why. Those who are currently looking for a transition, many of us, when we leave the federal government, wonder if there's a job that could ever be as good as what we just had. Because candidly, working in the federal government is an extraordinary experience and unmatched in what we get to do, the scale of what we do, and the impact. And so there's always this nagging question, is there anything that could be as good? And what we found is that through this approach, what this next job could be might not be higher paying. It might not be objectively of the same status as working in the secretary's office or in the White House complex, but could be equally, if not more so, fulfilling in a different dimension. that enables us as public servants to see how we can serve and make an impact just in a different way. And so what we want to change the game in Feds Forward is bring together two deeply mission-driven people, one who's seeking a next role and one who's trying to fill one, and have them realize that the uniqueness of what they want is not unreasonable to find. It's just that no one has bothered to unearth it and use technology to enable the match.
Pivoting a little bit to Feds Forward and the sort of resources that you guys offer specifically, can you talk about how your organization has grown over time and where do you see this going next?
In the fall of 2025 last year, we stood up the first version of our platform that effectively takes both somebody's resume and their kind of professional origin story and translates that into skills, hard and soft, and frames up some career pathways. Where we are now is we need an infrastructure that enables not only the translation of skills and identification of career pathways, but a technology stack that will also do the other side of the ledger of doing that same thing for employers and then matching. The ultimate kind of where we want to get to is to enable the federal government or any other employer, if employers are looking for that talent, that we can find with precision options for those employers, and for people that they don't have to wonder and create their own system and approach, that they should be able to focus on what they want to do and that will enable them to get there.
Well, Karen, thank you so much for your time today. I really appreciated hearing more about what you and Feds Forward are up to and just how you're looking at this challenge in a different way. So thank you so much for your time.
No, I appreciate it, Drew. And for those who are interested, we're at fedsforward.org. We stand as a nonprofit and would love to hear from those who are looking for their next thing or from employers who feel like they can't find the talent they need. The hidden talent is right under their nose, those who've worked in the federal sector.
Karen Lee is co-founder of Feds Forward, speaking there with Federal News Network's Drew Friedman. You can hear more of this conversation by tuning into Your Federal Life, Wednesdays at 1 p.m. The Federal Drive with Terry Gerton is produced by Eric White and Michelle Sandiford. Our web editor is Stephanie Wright. Are you shaping cloud policy, leading IT modernization efforts, or trying to deliver secure, reliable services? Join Federal News Network's Virtual Cloud Exchange June 10th and 11th for timely insights into how agencies are moving from cloud adoption to cloud optimization. Register today at federalnewsnetwork.com. For the latest updates, stay with federalnewsnetwork.com or follow us on Facebook, YouTube, and LinkedIn. I'm Terry Gerton. Thanks for listening.